Bismillahirrahmanirrahim. Today we will have a new rheumatology capsule regarding the proposed new classification for JIA, juvenile idiopathic arthritis. With the accumulation of diverse evidences, experts in pediatric rheumatology became more interested to revise the JIA classification system. You know that we have already the classification for JIA into 7 main categories. This is the ILAR 1997 classification for JIA, but it is very old. It is now 27 years old, and with more accumulation of evidence, some groups may be not suitable to be separate groups, and some other may be uh, non-specific and non-sensitive. And the main problem is that nearly around 15 to 50, in some studies 15, 20, 30, and up to 50% of the cases may fall in the undifferentiated category, which is a very major problem because we have many cases, and increasing the number of cases which have more than criteria of more than one group, so it is classified as undifferentiated, which will which will be not suitable for the proper diagnosis and the proper follow-up. So, with accumulation of these diverse evidences, experts in pediatric rheumatology became more interested to revise this old JIA classification system. As part of this process, Dr. Martini in 2016 proposed a prospective research plan on establishing a new provisional classification system for JIA in the 23rd European Pediatric Rheumatology Congress in 2018. Until now, 2024, it is not yet agreed. This newly proposed classification criteria or classification for JIA applied rheumatoid factor and ANA, which are the most frequently tested and useful autoantibodies for analyzing JIA, as we will see next. Here, a very simple comparison between ILAR classification and the new provisional classification. In fact, systemic arthritis, systemic JIA, will remain as it is, systemic JIA, but some may be filled in the unclassified. Unclassified means more than one classification criteria, more than one group. The oligoarticular, as you see here, oligoarticular, presented, polyarticular, and the polyarticular are F negative and positive, psoriatic and inflammatory related. All of these, the four of these groups, oligoarticular but its two subgroups, and the polyarticular negative and positive regarding RF, all of this depend mainly on the number of joints. However, number of joints per se is not so important. The more important is the ANA serology, ANA and rheumatoid factor, and you should notice that anti-CCB or anti-circulated peptide ACPA antibodies or anti-CCB is very important because it was not so evident in the ILAR classification in 1997, but now, especially if in the older child, nearly 14, 15, with negative RF but positive anti-CCB, he is actually having early onset rheumatoid. So he will not be classified here as RF positive because he is actually RF negative. But he should be classified as positive because he has anti-CCB positive. This will not be evident in the ILAR classification, but will be evident in the provoked or provisional new classification. So, instead of these 7 groups, we have only 6 groups. New provisional classification include systemic JIA remain as it was because it is actually a separate disease. In my opinion, systemic JIA and adult onset Still's disease should be separated completely from other forms of arthritis. It is actually one disease, actually separate disease with separate pathology. Most of the other diseases have mainly autoimmune process, but systemic JIA is mainly autoinflammatory with very special pathogenesis and treatment even compared to other. So in my opinion, systemic JIA should be separated completely from JIA, and it is called, for example, Still's disease, and the adult onset Still's disease is the late form of the same disease. So we have systemic JIA. We have RF positive GIA, or more accurately, serology positive GIA. So if the patient is not systemic, you will search for the rheumatoid factor and or anti-CCP. If any one of them is positive, you will classify the case as RF positive GIA or serology positive GIA. If negative, you will jump to the third class, early onset ANA positive GIA. In the previous rheumatology capsule, I showed to you the young girl with only one joint. So it is early onset and ANA positive. It is the formally called oligoarticular. For example, most of the oligoarticular and some of the polyarticular RF negative may have ANA positive and occurring early before the 6th year, I mean, and most of them are females. It is separate disease, not similar to any of the adult comparable diseases. For example, RF positive disease is very similar to rheumatoid, for example. And here, inflatus spondylitis related GIA is very similar to axial spondyloarthropathy. But here, this group of disease, early onset ANA positive GIA, EO small, ANA cartel, and GIA cartel, this disease is separate with very high prevalence for uveitis, very high prevalence for young age, and ANA positivity, for example. This group of diseases of patients are separate entity of the GIA. So EONANA GIA, it is the third type. The fourth is enthesitis spondylitis related GIA. Simply we combined enthesitis related GIA and psoriatic arthritis GIA in the same group. Like in adult, all of the spondyloarthropathies are group of disease, including ankylosing spondylitis, which is now called axial spondyloarthropathy, and psoriatic arthritis, reactive arthritis, Reiter syndrome, and so on, so on. All of these are called spondyloarthritis. Here, the pediatric spondyloarthritis, if we are talking properly, it is called here in this new provisional classification enthesitis spondylitis related GIA, or ESR GIA, and you should notice here that ESR is not erythrocyte sedimentation rate. No, ESR here means enthesitis spondylitis related GIA. If the patient doesn't fulfill any of the criteria for these four, he is called other, and if there is overlap, he is unclassified. This is the new provisional classification for GIA, and we hope to meet you in the near future with new rheumatology capsules. Wassalamu alaikum warahmatullahi wabarakatuh.